I would like to take the opportunity of thanking Harav Gaon, Rav Asher Weiss, for joining us today to answer a few questions that I think will be pertinent to the Lakewood community in particular we're asking about, but probably have significance to many other people through the United States and actually through the world. I'd like to thank the Rav for joining us, and again thank the Rav who joined us at our conference, which seems so long ago since before COVID, but it was a wonderful experience for us to have the Rav on board with us. As a lead up to some of the questions, Chemed actually at the start of the COVID took a lead in trying to get Lakewood prepared for what we thought was going to be coming. We actually met with many community leaders. We met with Rabbonim. We met with the health department, with other community health centers, with the hospitals. We had meetings together. We actually met with the schools as well. We advised, we tried to put a group together that would be able to track what would happen when COVID actually came into the Lakewood community. And unfortunately, we were hit quite quickly, and we had a very high number of cases initially in Lakewood, and all of our preparations went to naught. What happened is, at the time, it was just before Purim, and there was a lot of requests and discussions about whether we should be getting a message out to the community that there shouldn't be Purim masibas, and the yeshivas shouldn't have the masibas, and the children shouldn't go around collecting, and we should be much more careful. At that time, we actually did not have even a single case of COVID in the entire New Jersey, and therefore we decided at that time not to do anything, that there weren't any cases yet, and it was still a safe environment. And obviously, hindsight is 20/20 vision. But I wanted to ask the Rav, in hindsight, what would the Rav have said in terms of knowing where we were at that point? Would it have been pertinent for us to actually advise people to be more cautious in Purim? The only thing that we did advise at the time was that people should not dance hand in hand, but rather hand on shoulder. And this was actually in discussions with infectious disease doctors who had advised us that that was appropriate. But I wanted to ask the Rav what the Rav thought that we should have done back then.
I also want to open my remarks and responses saying that I have such fond memories from the conference, from the Chemed conference. From time to time, I participate in different conferences, but that was an experience that was truly unique, very special, and very, very memorable. What is the point in looking back and speaking about hindsight? The only relevance it has is planning the future. So we need to look back to the past to better know how to address the future. I thank HaKadosh Baruch Hu. We had the same dilemma in Etzesur Purim. And I think I was the first Rav in Israel to call off my Purim Mesiba. And usually Purim by night, hundreds of people gather in my home, and I called off the Mesiba. And every person that walked into my home, one of my grandchildren stood next to the door with alcohol gel, and there were no central plates on the table. Each person got his own private plate. Whatever is left over, throw away. And to the best of my knowledge, none of the people that came in and out of my house Purim was infected. It is very difficult to say what we should have done. Whatever we did, whatever you did in best of faith and in the best of the knowledge that was available at the time. We knew so little about this virus, and 4 months later, we still don't know enough about this virus. And every day there are conflicting opinions and conflicting expert advice. So we still know very little about this virus. I don't think there's a point in blaming yourself looking back, but I think planning the future, we need to be far more careful. So we need to take every, not reasonable precaution, but every possible precaution. Because v'nishmarta moed lenafshesechem reigns supreme, and pikuach nefesh overrides any other consideration. So I think we need to be extremely careful moving forward. With the knowledge and the data we had at the time, probably you took the right decisions. But judging from the past, I think we need to be far more careful in planning out the next phase and the next stage, how we serve our communities and keep them as safe as possible.
Thank you. Another question that I wanted to ask the Rav is, in the beginning of the pandemic, hydroxychloroquine was the suggested medication, which there wasn't any knowledge on it, but it was suggested that it would have a positive impact on the disease process. And many people initially were given hydroxychloroquine. Subsequently, it was withdrawn and it was decided that it wasn't appropriate medication for COVID-19. Now there's some suggestion in England that they're going to start a new trial of hydroxychloroquine to see if in fact perhaps there is some value in it. The question to the Rav is, we were, and we are, as the Rav said, still very much at a point where we don't really understand this virus very well. We certainly don't have an effective treatment against the virus. Is it appropriate to use a drug at a point during a pandemic when we are not really familiar with how this drug will work, whether it will be effective? We do know some of the known side effects of the drug, and we do know that people did suffer from some of those side effects. Is it appropriate to use a drug in such a circumstance?
I might have somewhat more medical knowledge than the average of, but I need to make very clear I am not a doctor, and I am very careful in stressing that point when people ask me for medical advice. I'm not qualified to give medical advice, but I do say one of the most fundamental principles in halacha that Chazal teach us: when you are in doubt, sheva al taisa odif. And I think that is especially relevant when we're dealing with medicine. So before medicine or any treatment has been proven, we need to be very, very careful. But one might ask, well, every new medication has a trial period. And every new medication, after we try it out on mice, on rats, on animals, at some point, we will never know what effect it has on human beings until we try it out on human beings. But the medical establishment and the scientific establishment in the modern world has certain guidelines. Yes, there is a trial period, and usually we trial out these medicines either on people that we have no other option, and their life is in imminent and in great danger. So we don't have that much to lose, but we might have a lot to gain. So there is certain criteria in the modern world how we perform a trial on new medications. And I think we need to uphold that criteria. And sometimes just the hysteria and trying to be the first to come out with a cure or with a vaccine might bring us to endanger many people. So all I could say is the principle that Chazal teach us: when you are in doubt, you might be causing terrible damage, you might be causing great benefit. If you aren't suffered, Sheval Taisa Odif. But if scientists, researchers, doctors feel that the benefit would greatly outweigh the risk, which means side effects would not be life-threatening, they might be somewhat harmful, but the benefit would greatly outweigh bigger risk. In that case, I would say that yes, it is justified to try out these medicines. But so ultimately, it is more of a scientific medical call than a rabbinic one. But all I could say is, when we are in doubt, and we might be causing terrible damage, and we might be causing great benefit, sheval tais odif.
So based on what the Rav just...
So I do think we need to be very cautious.
Based on what the Rav said, with all of the work that's being done on trying to create a vaccine, but a vaccine in a very rushed way, not in the usual amount of time that it takes to develop a vaccine, if the medical establishment or the scientific establishment comes out at the time and says that this is a safe vaccine that's effective, does the Rav feel that people should take that vaccine, or we should wait a period of time to see the effects of the vaccine once it's used on the general population?
If the medical establishment feels we've done appropriate testing and we think that it is safe, once again, I don't think that Rabbonim need to try to be more versed than doctors. But if it's a matter of doubt, and some doctors would say it's safe and others would say it's not safe, I would advise caution based on what I said before. Safek Pekuach Nefesh works on both sides. But if most of the doctors, and whether it's the FDA or the CDC or whatever it is, those that have the authority to decide, and they think that we've reached this point of research and whether it is safe, I would say then you should take that vaccine.
Thank you. Another question for the Rav. As I mentioned to the Rav earlier, Lakewood was hit very significantly, very early. And there was a very high peak initially, and everybody responded appropriately. The schools were closed, the minyanim were closed, people were at home, and then we started moving into backyard minyanim, and then back into the shuls. Baruch Hashem, for a period of time, we actually were down to approximately 1 to 2 new cases in the whole of Lakewood a week. There was never a period of no virus, but the numbers were very insignificant. The people who were getting the virus, it was very mild. At that point, would the Rav have said that it would have been appropriate to start looking to get back into minyanim? And would that be a point where it would be mutter to actually drop some of the social distancing and the masks, wearing of masks in the shuls, being that the numbers were so low?
I think the fundamental question would be, are the numbers going up in Lakewood now, or are they still 1 or 2 cases in a week? I think that is the most important question.
Right. So actually, I was going to get to that later. We've gone through 3 phases in Lakewood. We went through that phase of getting a huge number of initial cases. Then we went through a phase of probably about 5 weeks, maybe 6 weeks, of having extremely low numbers. And right now, we're actually getting into a second phase where we're starting to see a little bit of an increase in numbers. My question was really more at that middle phase when the numbers were so low. Would it have been at that point where the numbers were so low reasonable to become less concerned about social distancing and about wearing masks?
So what I say now, in a way, is a continuation of my response to a previous question when I said, I'm not a doctor. But when doctors themselves are so confused, and I won't say ignorant because they aren't ignorant, but there is so little information about this virus, then Rabbonim, sometimes must step in because we don't have clear, reliable medical and scientific data. So I was asked by many of my friends in Lakewood and in Brooklyn and in other communities in America, the numbers are extremely low. Could we just forget about COVID-19? Could we just assume it was a nightmare and it passed. And my feeling was, it is too early. It is too early. Theoretically, this might be coming back with a vengeance. I mean, Israel was mildly hit in the first wave, but now we are in a huge surge. Israel has more than 1,000 cases every day, many of them in the Haredi community. I am very cautious with numbers that I use. So if the numbers are ticking up in Lakewood, that might mean that it was a mistake to just go full blast ahead and throw away the masks and disregard social distancing and opening schools, in an entirely free fashion. So I very much hope, I said many times in the past few weeks, I hope in a month or two, everybody will laugh about Rabbi Weiss. I said that more than once, and I still hope that in a month or two, everybody will laugh why I was so hysterical. But to my dismay, up to this very moment, not many people are laughing about what I said. And I said a month ago in Eretz Yisrael, we need to be very, very careful because this disease is still among us. So I don't know what the numbers are in Lakewood, but if the numbers are ticking up constantly, that would prove that it was a mistake to just throw it all away and pretend that the virus has moved elsewhere. I very much hope what I say now will really be irrelevant in another month and will just be overly cautious. But the fact is the virus is amongst us, and we also don't know how long a person is safe after he had COVID. This morning I spoke to a person who had COVID in Pesach, and he has it again right now. So to me, it's not theory. I actually know a person that has a second bout with Corona. He was very ill Pesach, and once again, he's ill now. So the fact that we had so many cases 3 months ago does not mean that we're necessarily totally immune. So I do think that Baruch Hashem, we opened our shuls, Baruch Hashem, we opened our yeshivas. But the reality in Israel is we're opening yeshivas and we're closing them a week later. We opened shuls, and to my dismay, today a new regulation came out, no more than 19 people in a minyan. So I don't know what the situation is in Lakewood. If the numbers still are extremely low, I still think it is preferable to wear a mask when you come close to people. It is preferable in as far as possible to have somewhat distancing. Don't think that this virus has disappeared. It hasn't disappeared. It's still lurking in the shadows, and we still need to be very careful.
Thank you. Another question for the Rav is that in Lakewood, as I've mentioned several times, there were several people who were infected with the virus. We actually had 74 wonderful neshamas that were lost from the community during COVID, and several others who were hospitalized with very difficult situations. It did result in an antibody level within the community. We've tested at Chemed over 10,000 people from the community, and we have an antibody level of about 40%, which is much higher than the general population. The general population in New Jersey and most of America is reporting levels of about 5% with maybe a high of 15%, but the average of about 5%. And I saw some numbers like that in Europe as well. Although the CDC has not come out and said that we can rely on the antibodies, as Rob mentioned, however, there does seem to be a protection from the antibodies. I was on a call with Dr. Fauci, and he mentioned that, we shouldn't, technically the antibodies should work as they do work with any other virus, giving some form of protection to people. Is that something that people can be a little bit more somech on, the fact that perhaps there's more of an immunity, not a herd immunity, but a higher level of immunity in Lakewood, because many people, actually most of Lakewood, think that there's about 75 or 80% of the population with antibodies. The reality is, on our testing, we still have 60% who are at risk. So even if you would take the high number relatively of 40, we still have 60% at risk. However, many people in their minds are thinking that we have 90% of the population who have antibodies, and therefore the risk is minimal. What would the Rov's advice be?
You know, I feel confused answering many of your questions because, once again, I'm not a scientist. I don't know the science of viruses and epidemics. If we have 40% of the population with immunity, with antibodies, how come there is so little new infection? So, you know, we're just guessing, but I am a Baal Svara. And if my feeling is, and what I say now is totally unscientific, but I would assume there are a certain percentage of human beings that aren't affected by this virus. Whether, you know, even in worst epidemics in history, the Black Plague, there were millions of people that weren't hurt and didn't fall ill. So maybe besides antibodies, some people aren't just susceptible and the virus won't hurt them. So I don't understand if we have 40% of the population that achieve this level of immunity because they have antibodies, but still 60% are not safe. So why don't we see that much more infection? Why don't we see that much more disease? So I don't think the percentage points of people that have antibodies is the more important factor. More important numbers are how many new cases are we seeing? So if a community like Lakewood, how many people live in Lakewood? How many nefashos, not families? I would guess it's about 50,000 people. How many people live in the greater Jewish community of Lakewood?
It's probably about 75,000, 75,000.
75,000 nefashos, right? And if you have 1 or 2 cases a week, that is an extremely low number. So I don't know what to make of it. If 60% of people still are at risk, how come we have 1 or 2 cases a week? So we don't understand the science. And I said before, this virus is we still have so much to learn. So I don't think the important numbers are the percentage of people that have the antibody, but rather, what are the numbers of new people being affected? And Atzola should know better than anyone else. But maybe there are many, many people that just don't report and don't test. And they are getting COVID. And the more people that have corona are going to pose an extreme risk to the elderly members of the community, because at some point you could no longer insulate the ill, the sick, those that have a compromised immunity, and the elderly members of the community. So theoretically, there might be hundreds of people that are infected, but they have relatively mild symptoms, and they don't report. So even Atzola wouldn't know about them. Atzola knows about the people that go to the hospital, that feel ill. So I am very concerned, and that is why I once again say, don't close your shuls, but I would be happy to see people wearing masks, not giving, you know, I haven't given a hand to a person the past 4 months. I haven't shaken the hand in 4 months. I usually shake 1,000 hands every day. So I do think that even in Lakewood, we still should exercise caution. Baruch Hashem, yeshivas are open, shuls are open, but I still would be happier to see more masks and more social distancing.
So actually, just to fill the Rov in with what happened in Lakewood, and as the Rov said, we don't understand everything. The numbers did drop significantly, and we created what they're calling a safe bubble within Lakewood, where the numbers were very insignificant. I'm not understanding fully why. However, there were many hotspots that are now very active around the country: Florida, California, Arizona, Texas, and obviously people coming from Eretz Israel as well. And they've introduced new virus into the community. And we've actually worked, Chemed, together with all of the physician practices in Lakewood and together with Hatzalah to create a tracker where we track every new case so that everybody is aware of what's going on. And we've found about 4 different points of entry so far where people have come. Actually, all of them happen to have been from Miami, and they introduced infection into Lakewood and resulted with about 9 or 10 people in Lakewood being infected with the coronavirus. And obviously we've been tracking that, quarantining people, being concerned that this is a new point of entry. We've been very vigilant to warn camps that they should be careful not to take people who are coming directly from Florida. The question to the Rav is it appropriate to tell anybody, first of all, is it appropriate to tell people that they should not be going to any of these places for a vacation? For example, I'm personally aware of several people who are planning vacations to Miami because they just feel they need to get away. Would it be appropriate to tell people that this is not the time to be going to a place where there's a high incidence of corona just for a vacation?
So once again, if a person wants to rent a villa on top of a remote hill overlooking the ocean somewhere in southern Florida, middle of the Everglades, and he's not going to be in contact with anyone else, I don't think he's putting himself at risk. But if he wants to mingle with people in Florida and he wants to go to shul and see people and travel and tour, and he's going to expose himself, mingle with other people, it is definitely not the appropriate time. First of all, flying is a risk. For the past 25 years, every summer after Tisha B'Av, I've been spending time in the Alps. Baruch Hashem, I'm always marbitz later. So I always have the halachic justification for leaving Eretz Yisrael. Wherever I go, I give shulim every day. But this is the first year in about 25 years that I'm not planning to leave my home because flying is a risk. And I think this is a time, this is a time, just be at home, minimize, just stay at home as far as you can. I do not think it would be wise to travel to those hotspots in which the disease is far more rampant than it is right now in Lakewood. I think that's a very, very, I don't think it's a wise decision. I think this is a time to stay at home.
If people do travel to a hotspot, does the Rav think that it's appropriate to tell them that they are not allowed to come into Beis Midrashim or other
definitely
place where there's a rabbim, unless they quarantine for the appropriate 14 days?
I think so. Safeguarding the broader community would always override the rights of the individual. Always. And the spread of disease is a safek pikuach nefesh. So you might infect young people, healthy people, they won't even be aware of it. But Pliny would affect Almoini and maybe the 10th person down the line. And that 10th person down the line could be in 1 day or in 2 days. And he's going to be a person that's getting chemotherapy or an elderly person. And chas v'sholom. People were sitting across me at my desk and crying because it was obvious to them that they caused the person to pass away. They caused the demise of a person by being negligent and not following the rules and asking for tikkun tshuva. We don't want to be in that situation. Nobody wants that feeling. So I do think it is justified to ask people that are coming from those places in which the disease is rampant, if you want to come to our shul, you need to quarantine. Stay away from shul. Davening b'yechidus is not an avera. It's not an avera. We must understand this. Yishtadel ma'oid l'spala l'matziba, the two rights. But it's not an avera. So if there's any risk you might be causing the spread of this disease, stay at home. Don't come to shul.
This may be a little bit of a difficult question, but how does this apply to Mishlochim who are coming from Eretz Israel? Many of them are very difficult matzav they need to collect. But on the other hand, they are going house to house to house. In Lakewood, the Mishlochim are not going around with masks, the majority. And I know some people do open their homes, some don't, some feel that it's a risk. What would the Rov's advice be?
As careful as we are with COVID-19, we need to understand there is a certain pattern to the spread of disease. L'moshel, having a Zoom conversation won't put neither me or you in danger. So if a person stands 15 feet away from you and you're wearing a mask, I don't think you're at danger. I think we have the right to demand from a shluchim, if you want to go around, put on a mask. If you don't put on a mask, we won't open our doors. So, I really don't want to be the one to hurt anyone in the world. And people that are collecting money desperately need that money. In my shul, Mishlochim come around every day in the morning. They do wear masks. But I do think they're putting the members in danger, because if a Mishloch goes to 20 shuls every morning, and in 19 out of the 20 shuls he wouldn't wear a mask, he's coming into my shul and he puts on a mask. That doesn't mean he's not spreading the disease. But nevertheless, I don't want to stop people from collecting money in my shul. So yes, I'm not happy about it, but there's only that much we could do. But we do have the right to ask a mishloach. You want to knock on my door, wear a mask. So you're a nice guy, and you usually invite him to sit down on the table, and you schmooze with him from 2.5 feet away. I think give him your money, but don't be so friendly, and don't be so nice this time around, because you need to care for your family, for yourself, and we need to stop this scourge. So I don't know what to say. Close your doors for Mishlochim. If a person is collecting money, he obviously needs that money desperately. But I do think we could demand from Mishlochim. You're knocking on so many doors. You're seeing so many people. You are a potential time bomb. So do your best. Wear a mask. And you don't necessarily need to bring them into your home and schmooze and spend time with them in close quarters. We need to find the right balance to give tzedakah, to be embracing, to be forthcoming, and to do our utmost to prevent the spread of disease.
Thank you. What is the Rov's advice to a lot of the senior population and the at-risk population? Lakewood has opened somewhat and is much more of an open society now, although we're not sure exactly what impact these new cases will have. But certainly the senior population, the at-risk population, has kept at home. They have not, many of them have not gone to backyard minyanim. They've really kept within their homes. They've had their food, their supplies sent to them from the shops directly. They are still being very cautious. Does the Rav feel that there's any advice we should be giving from a halachic perspective to the seniors and at-risk population?
I do think, the big problem is how long will people be able to lock themselves up and not see their families, not see their eneklach, not see their children. And sometimes it's a huge emotional strain, psychological strain. So on one hand, I just commented a few moments ago, we could take preventive measures and be relatively safe. Wear a mask. You can have your kids come over, disinfect their hands when they come in, keep a distance, Have them all wear masks. Don't hug your aniklach. Don't kiss them. Don't come too close. But still, if you take the proper precautions, we could be safe. And you don't need to really lock yourself as you're in a maximum security prison. But I do think that the seniors and at-risk people should not feel bad about davening at home. And let's take advantage of technology, learning Torah, teaching Torah, participating in shiurim by Zoom, just like we're doing right now. But I do think it is important also for the emotional well-being and psychological well-being of people. They should see their families. And this is a very relative question. Some people will be happy to see their families just on the screen. Others will feel we want to see them closer by. Take all the necessary precautions, but don't feel bad about the fact you're not going to shul. Chazal deal with a situation in which a person can't go to shul, and Chazal say, Yespalal b'shor shatziva mispalalim. And my psak is, if you hear on the phone, or you see by Zoom, even a Hoichesh Shmonesa, you can answer Kedusha, you can answer Amen, even though it's not considered as if you're davening with Minyan. Okay?
Does the Rav have any last advice for all those who are listening?
One point I want to make. This entire conversation was about how to keep ourselves safe. But besides all the measures which are medical, scientific, let us not forget that HaKadosh Baruch Hu controls the world. And at a time of epidemic, we also have some ruchniistic tools in our toolbox. Some ruchniistic gulas at our disposal. And let us not forget about these. We need to daven a lot, say a lot of Tehillim. So I recommend saying 3 prokim after every tefillah, Chaf, Kuf Lamed, and Mem Aleph, which are especially associated with refuah. Try to say Parshas HaKtoros every day, b'chavana. It's an unbelievable zgula that we find in the Zohar, and Rabbi Kiva Eger in his famous letter wrote about it. Try to say the Akedah every day, which is another zgula we find in Zohar. So besides wearing masks and social distancing, let us not forget that we are Anshe Emunah. And we know that HaKadosh Baruch Hu is in charge. And we need to daven a lot, learn Torah, daven. Try to be a better Jew than you ever were before. And the zgulas I recommend is every day Parshas HaKtoros. Just in Parshas Korech 2 weeks ago, we read about the plague in the days of Moshe and Aaron. And the Gemara says in Shabbos that the Malach HaMavis himself revealed the secret to Moshe, that Titus stops an epidemic. So I recommend that everybody says Parshas HaKtoros B'chavana every day. Try to say the Akedah, Parshas Akedah, and say a lot of Tehillim, at least those 3 program that I recommended. And HaKadosh Baruch Hu should take this awful pandemic away. And Lakewood has paid a horrific price. I hope there will be no more tragedy. Because we should only be Mevasa B'Seiris Tovis Yishuas V'Nachamis. And Dr. Friedman, thank you for all you've been doing to serve the community. It's an amazing schus, and I'm happy to be on board. I'm happy to being able to share my minimal input to the broader Lakewood community and to the Chemed organization.
Such a schus for me to be able to have the interview with the Rav. I thank the Rav so much. Thank you very much.
We should only hear B'Seiris Tovis.
Amen. Amen.
Kol Tov.
Kol Tov, thank you.